I sat on the board of a Medicaid provider. I sat on the board of a hospital. I sat on the Senate Finance Committee in Virginia, the subcommittee that handled healthcare and Medicaid. And the one thing that I know with certainty is that the reason the cost of Medicaid has gone up is not because of waste, fraud, and abuse. It is because people are living longer than they did in 1965. It is because they are living with more complex illnesses than they did in 1965. In part because the very communities that Medicaid was designed for were redlined into communities where pollution was emitted into those communities every single day, where their neighborhood was literally cut off from food, work, hospitals, by a highway. The cost of long-term care is going up. The cost of prescription drugs is going up. In every meeting I was in, on the Joint Commission on Healthcare, on the Medicaid provider, the hospital, the Senate Finance Committee, we were concerned about the cost of prescription drugs going up to take care of these measures. And in the last administration, in the 117th Congress, you did something. I wasn't here. You did something to help reduce the cost of prescription drugs. That's under attack. We have hospitals in rural areas that were closing until Medicaid expansion came. You have hospitals and providers that are struggling to stay open and struggling to recruit and retain the best and the brightest workforce because the reimbursement rates they get are so low they can't pay them. Cuts to Medicaid, which are going to be necessary to get to $880 billion, which you've already heard. Cuts to Medicaid is basically forcing states to raise taxes because Medicaid is a state-federal partnership, and states are already struggling to meet their portion. So you're going to make that problem worse. Medicaid expansion allowed people who never got preventative care to get preventative care. And we have heard from the other side of the aisle how it is more expensive to treat people when they come in the emergency room, where you have to treat them. And if the hospital, the provider doesn't get paid, that cost trickles to everybody else and makes our costs go up. That's all basic fundamental fact. If you sit in a state legislature and look at what they're looking at, if you sit in the hospital boardroom looking at the financials, what they're looking at, if you sit in the boardrooms of the Medicaid providers and what they're looking at, and putting your hand in the sand and saying, we've got to reduce the deficit when the President of the United States wants to add, what, $4 trillion for tax cuts for billionaires. Your budget, your oversight plan is a statement of your priorities. What I hear from my colleagues on the other side of the aisle is your priorities are billionaires and large corporations. When I talk to my constituents, when I had a record number of constituents show up for a teletown hall meeting, more than double than ever, they weren't saying they wanted tax cuts for billionaires or corporations. They were saying, please don't take my health care away. Don't close my rural hospital. Don't take away my veterans' benefits. And we better listen. Because in Virginia, we got to quote Thomas Jefferson. If you went to UVA, you got to quote Thomas Jefferson. In the Declaration of Independence, it says, we are all entitled to life, liberty, and the pursuit of happiness. Life is first. And the government is set up to help you achieve and maintain those rights. Healthcare is a fundamental right. I yield back.
Gentlelady yields. The gentlelady from California is recognized.